Good day. My name is Makinie Fortino. I'm a licensed marriage and family therapist, and I'm also the founder of Deconstructing the Mental Health System, which is also doing business as DMHS. And what we're doing is we are working on building equity into the mental health system. We recognize that there are a lot of hurdles in people of color seeking access to mental health services. There are a lot of hurdles with regards to therapists of color working on entering the mental health system and also retaining work, because there are a lot of financial hurdles to maintain licensure in this system. And so we're doing what we can in a number of ways, and I will walk you through that in our DMHS annual report today. We incorporated in September of 2020, and we received 501c3 status from the IRS in December of 2020. So we are a 501c3, which means that donations are tax deductible. Before I show you anything else or give updates about the work that we've done so far, I think I may want to give you a site update. So let me take you on a tour. When you go to DMHSUS.org, this is the landing page. Last year when we went on this tour, you may have noticed that this section here had a lot more links. We've tried to organize that and condense it a little bit. So nothing has been removed, but we have organized it. So you'll find information about who we partner with and what our mission and vision is, information about our volunteer team and board of directors under the About section in this dropdown. You'll also see resources for providers, which I'll talk a little bit about, as well as resources for the community, which has the links that I showed you last year, the organizations we like, the Get Help and resources and community offerings, which I'll show you all of that today as well. That's the fastest way to navigate the site. And the other piece is, if you scroll down a little bit, we tried to organize it in a way where you could get sort of a snapshot on the landing page of all of the services that we offer, which again, I will go through today, I promise. We've updated our mission and vision, so I think it might be good for me to share that with you. We've also, as you can see, updated our logo as well. So who are we? Deconstructing the Mental Health System, DMHS, is a group for mental health professionals who are actively increasing access to mental health and wellness services for Black people, Indigenous people, and people of color. We assist emerging Black therapists, Indigenous therapists, and therapists of color in obtaining, maintaining, and navigating the bureaucracy of mental health licenses by offering free public advertisement and marketing of services in our therapy and wellness directory, as well as encouraging participation as volunteers in the DMHS free therapy and wellness program. DMHS also offers the necessary tools, including free clinical supervision by fully licensed approved supervisors. And our mission update is, the mission of DMHS is to achieve an equitable, anti-racist mental health system through acknowledging how intersectionality and racism impacts any system affiliated with current mental health system. We effect changes and build equity into mental health system through collaboration with community partners in delivery of therapy and wellness services, working towards making access to maintaining licensure status more financially equitable, access to free advertisement, supervision, and marketing, providing direct services to our communities for more effective and equitable therapy and wellness delivery. And we also provide education to the community on implicit bias, reducing harm to our communities, providing culturally relevant and equitable services, and community healing, which is a mouthful, and it has a lot of updates, as you can tell. In the original mission and vision that we had, our goal was to have racial trauma recognized by the ACA and by the DSM and ICD. But we realized in our work in doing direct services and connecting people of the global majority to therapists of the global majority, that we already recognize that we have racial trauma. we also have the solutions to that, to our own healing through community wellness and community care. So we don't necessarily need to be recognized by the DSM or ACA or ICD. We recognize ourselves. And so that was how the new mission and who we are was constructed by the board this year. A couple other things that I will show you is I'd like to highlight that we also have language translation and accessibility considerations built into the website as well. I don't know if I showed this to you last year, but I will show you now. So if you experience low vision, you can do things like increasing or decreasing the text, doing high contrast, link underlines, and changing the font as well. And if you are sharing this website with people who are not native English language speakers, or English is not the first language, this can be translated into quite a few languages. One of the first things that we want to give you an update on is that there has been an increase in over 100 listings from 2022 to 2023. As you can see, if you're comparing this to the previous annual report that I gave, there are also a lot more categories. How this happens is we build this with our providers. So we reach out to providers, ask them to add their listing, but we also ask for feedback because we want to make sure that their identities are also highly visible and easy to find for people who are searching for them. So even in the attribute section, we're looking for very specific things. There are even more pieces added for identities or identifiers or services provided by our providers. You can also see here that we have added categories regarding to the free therapy and wellness program that we launched in, I believe it was October of 2022. And I'm looking for any other pieces, any other updates here. I think those are the main updates. But one thing I'll do really quickly is kind of bounce between the website and the update, because there are questions about how to navigate. So I will show you really quickly a couple of things. For anyone who's looking to add themselves to the listing, we do have a video tutorial. So if you click on that link there, it takes you right to the tutorial on how to list yourself. And now I will show you, there are a couple of ways to find what you're looking for if you are somebody seeking services or wanting to share this information with people seeking services. So I'll type in an insurance network. And these are all of the providers who accept that insurance. So that is the first way that you can do a search. Now let me show you a more specific way. So as I was talking about, attributes are co-created with our providers. They tell us the identities and the services that they would like to see, and we add them. So let's see. Let's look for a provider who works with families and offers sliding scale. And what sliding scale means is they have their services that are listed, but sometimes sometimes we hold lower cost slots for clients. So a lot of therapists will hold 1 to 2 spaces where they offer reduced cost sessions. So we click sliding scale and family, you scroll to the bottom, and then you click filter. So these are all of the Black providers who offer sliding scale and also work with families. And you won't see that in this section here. You'll actually have to click on a listing. So what we'll do is we will click on a listing for you to confirm that information. And this is where when you click on a listing, you can see more information about the provider as well. The next update for you is that we are up from 57 organizations we like, up now to 76 organizations. These are organizations that are predominantly led by people of the global majority serving communities of color. Not all of them, but the vast majority of them are. And many include directories as well. So if you can't find what you're looking for in our directory, we do list other directories to make sure that you can get the services that you need even faster. And if you can't find it in any of those pages, we have the community resource page, which has a lot more information. And the way that we organize it is people of the global majority are prioritized first. So in the first half of the web page, you'll see information for communities of color. And then in the bottom half of the web page, it is information and resources for all communities, categorized by need. So it includes services for veterans, parenting services, services for youth, support groups, and a whole lot more. We have, I believe, over or almost 300 links on the Get Help and Resources page. We are actively also looking for live events, art events, free housing, all kinds of resource opportunities that we list in the community events page. And these offerings are predominantly for people of color as well. So we keep an eye out for that. And we also prioritize organizations that we partner with to make sure that we help advertise those offerings that they have. We keep an eye out for free and low-cost education. As I mentioned in our mission, we're really looking to help cut the cost of staying licensed as a provider of color specifically. So we keep an eye out for any trainings that include CE credits, CEUs, continuing education credits that help maintain licensure. We also advertise for trainings that don't offer CEUs, but if we feel like they help train people on building equity into their services and we feel it's important enough, we do advertise those trainings as well. So for the free therapy and wellness program, I feel like there are a few, I've gotten questions about, what was the motivation to start this? Where was the first time that you were exposed to free therapy? I was exposed to free therapy as a child, so free therapy was included in school. So I would say as young as maybe 5 or 6 years old was the first time that I had received free therapy services. Now, did I understand the implications of that? Not necessarily. But when I got older, I received my graduate degree. In my very first job, we were providing free services in a nonprofit that was partnered with Department of Children and Family in Florida. So that was the very first time that I did see the impact of people being able to receive high quality services for free. Now, as I mentioned in the introductory video, just because something is free and just because I can see the impact does not necessarily mean that it's always helpful. These services were mandated. And so one of the things that was on my mind was, I wonder what free services would look like if it wasn't mandated, if it was something that a person actually wanted to actively engage in and receive services from. So that was back in 2013 was one of the first times that I had started thinking, okay, I know what free therapy looks like, and I also wonder what it could potentially look like for free. And as for the origins of the free therapy program itself, It is pretty much based on a free therapy program that I designed, co-designed for the state of Washington with my counterpart. We designed a free therapy program for students offering 12 sessions, and we decided on the number 12 because, not because we're 12s, but because oftentimes programs will offer, 4 to 6 sessions, and we find that by session 4 to 6, the assessment has been completed and rapport is being built, but the deep work hasn't really begun yet. And around session 12, maybe 1 or 2 goals out of 5 might have been accomplished, and the client is really getting a feel for therapy and deciding if this is something that they would like to be a long-term investment. That was in January of 2020, and around September of 2022, after some conversations with providers, including a provider with a doctorate who was also an approved supervisor, we developed this program to be an equitable exchange that included training for associate therapists who were working on becoming fully licensed, and for the public who were seeking free therapy. And so we partnered with an organization to provide free supervision to their associate therapists in exchange for their associate therapists taking on 1 to 2 clients for 12 sessions. And that started off with just 4 of us. And we were doing that 100% volunteer until we did receive some funding. And now we're up by 28 providers. We're at a total of 33 providers doing various services from wellness to therapy to supervision. And I will show you that page in just a moment. These are some of our providers who are most popular. Robert, you see he has a star next to or on his profile. Any providers that you see with stars on their profiles have gone above and beyond for DMHS in the year that you do see that. And I'll talk a little bit about some of the work that Robert has done to help expand DMHS free therapy and wellness services. But first, what we'll do is I will show you what that page actually looks like and how to access the waitlist. So this is the page. It's dmhsus.org/DMHS/free/therapy. Here's where you can find out some of the information about the services, how to receive them, who's involved in the work that we're doing. This is where you can check out the actual application. And this application was built with a number of providers who specialize in different services, from youth to elderly to various racial backgrounds, as well as our board who reviewed it. So for someone looking for services, this is what they would click on and fill out the information. And we wanted to get enough information that would help us with screening in a way that didn't feel too overly intrusive. So this takes about 20 minutes to complete. We do ask if people are struggling with being able to afford services, and if they would like to attach supporting documents, they are welcome to, but it's not required. If someone says that they are struggling with receiving services, we do take that into consideration in approving applications. As you can see, there is a wait list for the general application. So we are partnered with Powerful Voices and Why We, which serves youth who identify as people of color, girls, and or gender expansive, so queer, trans, people of color. And we provide their youth, the youth that they refer to us, with services. And so if you do know any youth who are in King County, Washington, they are accepting referrals. And the cool thing about that is we have not in this year of being open closed our doors fully, because we are able to work with our partners in this way. And here are the other providers that you can see here. And I'll tell you a little bit more about what's going on with free therapy and wellness. And at the very bottom, we have a longer video where I speak with one of our board members, Felicia, who is also a provider through the free therapy and wellness program, about why we decided on 12 sessions. So let's talk about the free therapy and wellness program by the numbers. So an average of 30 sessions per month. So we're doing an average of 30 sessions per month, totaling so far around 354 sessions between January and November of 2023. We've received 145 applications since September of 22, and 91 referrals were made for 12 sessions each this year. And what are our clients saying about it? So many are saying that they are satisfied with their most recent counseling session and that they feel like their provider helps them with developing coping skills to work through life's challenges. Many are also saying that in their application, they were experiencing financial hardships and might still be while receiving services. So our services are valuable in the sense that we are helping people that would not otherwise be able to afford services. Would they recommend it? Over 92% of people said that they would recommend services. And over 92% said that they could or would benefit from more than 12 sessions. So that is something that we are paying attention to. Is 12 enough? We're looking at this, we are looking at this and thinking about potentially increasing the sessions that we offer. And here's some more feedback that we have received from our free therapy and wellness recipients. My therapist has been a great resource. She listens, she helps me process my feelings and sets goals for myself. I finally feel like I have a fighting chance at life and healing. So these are some of the things that are being said, and you can read a couple of others here or more at dmhsus.org/testimonials. We are now piloting and working on providing workshops for our communities. So these are 2 workshops. One that was done earlier this year in August, and one that's actually coming up next week. So the one in August was with the lovely Michelle B., who is a licensed marriage and family therapist, but also does some coaching. And the workshops that she provided was Explore Emotions Through Poetry. And Tracy Stewart, who is a licensed mental health counselor, is going to be doing a virtual and in-person workshop next week called Mindfulness for Change. And you can find more information about these trainings that we have and other information for our community members at dmhsus.org/resources-for-community. The other thing that we're doing, though, is working on piloting trainings for mental health professionals. And I'm actually going to read you what we put in the PLLC cohort and scholarship recap before I talk a little bit about that. So what we put was, DMHS seeks to actively expand the Black, Indigenous, and people of color therapist workforce in Washington State. Our trainings will have a direct impact on our communities of color by providing more options of therapists with shared identities by the end of 2023. The impact we intend to have is BIPoC providers in private practice, which statistically results in retention of the mental health workforce, increased access for BIPoC clients to clinicians of color, and inevitably reducing the likelihood of racial trauma occurring in therapy sessions, financial independence and security for BIPoC therapists, and increase in BIPoC leadership in the mental health community. We do not operate in silo, and many of the issues that we have as providers comes from isolation. And so in having conversations with community members and also therapists, this was one of the initiatives that we really wanted to work on. I know for me, I was experiencing what's called imposter syndrome for a very long time. It took me years before I decided to launch into private practice. And we wanted to help emerging therapists basically cut right through that, and in it with community, build their private practice together. So that is the legal requirements and cultural considerations of forming a PLLC. This was otherwise known as PLLC cohort, which was taught by the lovely Taquisha Dean and Nicole Wilson. They are licensed clinicians who had recently started their private practices. So they knew the process. It was fresh in their minds what starting a private practice was like for them. And one of the pieces of feedback that I got from both of them when they were building out the content for this initiative was that when they were building their private practice, they built it in basically by pulling information from their support systems. They would reach out to different therapists. I was one of the therapists. And they would say, hey, what did you put on your website? Is this how you register your business? You know, they had a lot of questions about starting private practice, and they pulled the information together as best they could. And we decided to build out a 4-part workshop to help people get that information in one place, and they also designed a workbook to go with it for people to refer back to, so that they wouldn't feel like they have to reach out to all of these community resources and sort of workshop their private practice. They would feel like they have more structure and support, and they could also support each other in the process. While we were doing that, Seema from Peaceful Soul Healing, which is a group practice, reached out to me and said that she was wanting to raise money to do a scholarship to help a few providers start their private practices with the help of legal assistance from an attorney. So what we did was we raised $3,000 and we were able to, around $3,500, and we were able to offer 3 of our attendees of PLLC cohort the opportunity to work with Mercer Law Group in building their private practice. And then we offered a 4th person funds for marketing their private practice once it opened. And so that's basically this initiative. There will be more in the future. We do have some funds from a donation that we received. Thank you so much, to run this program next year. So please keep an eye out for that. The other thing was that the PLLC cohort workshop was sponsored by WMHCA. So we were able to offer 6 continuing education credits to anyone who attended. And we offered this for free. We did have a pay what you can option because we were able to pay Taquisha and Nicole, but not what their work is actually valued at. And so we did ask the cohort if they could contribute. It would be helpful, but it was not required. And you can find this and more information at dmhsus.org/resources/for/providers. And this is what that resources provider section looks like. So what are our attendees saying about the community events and DMHS trainings? So a couple of quotes that we got was, I thoroughly enjoyed all of the presentations. Each of the sessions has given me different knowledge on how to build a private practice. And for exploring emotions through poetry, someone said, one of the things that they found most relevant or memorable was viewing emotions as messages and not negative or positive. So the question you may be asking yourself is, what is the financial impact of all of this work that we're doing? So I'll just go ahead and read this right from the slide so I make sure that I get the numbers right. So the average directory listing costs anywhere from $20 to $40 per month. By offering a free listing, we're saving our providers around $360 per year. We are helping save money in advertising for organizations listed in organizations that we like, as well as the resources page that we have. because we're helping to connect community members to these organizations, but we do not have a number or figure for how much money we're saving in advertising. But we do know that people are being connected through our site. Therapy sessions can cost anywhere from $80 to $200, on average around $100. By offering 12 sessions of free therapy, we're saving clients an average of $1,500. For January of 2023 to October of 2023, we saved our clients over $45,000 in wellness session fees. For November of 2022 to November of 2023, we've helped therapists save approximately $100,000 in directory listings if they did not advertise anywhere else. $7,000 in PLLC cohort training, $3,400 in legal and marketing fees, $2,900 in approved supervisor training, and $4,000 in free supervision of direct services. So for that last figure that you see there, in the free therapy and wellness program, you probably saw at the bottom when I scrolled down that there were supervisors, approved supervisors. And so any services that were offered to our therapists who were volunteering their time in therapy, that's the amount of money that they saved in supervision. So how can you get involved? There are a number of ways that you can get involved. If you are an accountant, a virtual assistant, or an attorney who offers pro bono services, we would love for you to contact us. If you're an agent affiliated or associate licensed therapist seeking supervision hours, open to volunteering 2 to 4 hours per week in sessions for clients, you can receive free supervision. And if you're a mental health equity enthusiast who wants to donate an hour a week of your time, we would love to be in contact with you. Who builds with us? A lot of people build with us, and we do not hide that fact. So if you go to our gratitude, legacy, and partners page, you will see the organizations that we partner with. And I'll actually show you that very quickly right now. So under About DMHS, when you click that drop down under gratitude, legacy, and partners, these are the organizations that we are currently partnering with. And you can see, if you look under their logo, how we partner with them. These are our any sponsorships that we received for any of the initiatives that we have done, our funders, our core contributors. But I also want to show you this bottom section. These are all of the collaborations that we've done and contributions to initiatives. These are the names and organizations of people who have contributed something to any of the pages that you see, from our directory to our free therapy and wellness program, to the categories in our directory, to the services on our resource page, even to the way that our website looks. We make sure to give credit to those who give us any feedback or recommendations. So please come check this page out. We also wanted to highlight and share some information about some of our volunteers, and there's a story for each one. So I mentioned earlier that there was a star on Robert's directory listing on the free therapy and wellness program, and that is because he is going to be the DMHS free therapy and wellness Spanish coordinator. So what Robert did was he volunteered hours of his time and translated our screening forms, as well as our FAQ page, the frequently asked question page on the DMHS free therapy and wellness page. And he's also going to be helping to screen applicants who will be able to fill out their application, which was translated by him to Spanish. And he'll also be helping to be providing services there as well. All of that time was donated by him. Tracy Stewart just was, man, the universe just made the connection there. So I mentioned that Tracy's going to be doing a workshop next week on mindfulness. But in January, we connected, and I was talking a little bit about how I'm just not the best grant writer and could use some guidance. And Tracy offered hours of her time in grant writing, mentorship, and collaboration. And I'll tell you a little bit about the results of that. And you can see at the bottom, actually, that Tracy helped raise over $20,000 in donations and $132,000 in grants for DMHS, which is just amazing. Seema from Peaceful Soul Healing connected me with Letty, who is an intern there at this time, who's looking for guidance on grant research. So I'm doing a pay it forward and taking some of the mentorship that Tracy provided me with and doing that mentorship for Letty, who is helping to sort of organize different grant information for future applications that we'll work on together. And Sarah is just absolutely amazing, helping with quality assurance and auditing of our work on the back end to make sure that everything is matching up financially, but also making sure that any public facing information is up to date and accurate. So let's talk about some of those grants that that Tracy helped DMHS work on applying for. I can only talk about one because two actually have not been announced yet. I'm really excited about both of them, but I'll make sure to include that information in the future, hopefully the 2024 annual report. But I can tell you about Seattle Foundation's Neighbor to Neighbor Spring of 2023 grant that they had, and you can check that out on their spotlight link here. But we wrote an application to get some funds for our training initiatives. So exploring emotions through therapy, the mindfulness training that's coming up, or exploring emotions through poetry, I'm sorry, exploring emotions through poetry, the mindfulness training, PLLC cohort, as well as the approved supervisor workshop, which I didn't talk about, but you can certainly check that out on our website. All of those were were covered by Seattle Foundation's Neighbor to Neighbor grant. So we do hope to be able to do even more trainings next year, and so we'll probably be doing a reapplication. But yes, please keep an eye out. We are continuing to apply for grants, and those are so far the ones that we have received. And I want to give a big thank you to those who donated. That includes Seattle Foundation, Goldman Sachs, Philanthropy Fund, Fidelity Charitable, Neighbor to Neighbor, KDG, Anonymous A, Nafasi, Tanya, Kim, Zane, Kirby, Candace, Christine, and Jane. Thank you, thank you, thank you. The first round of people in the free therapy program that we were able to help is because of your donations. And the number of people that we'll be able to help next year is because you helped us establish ourselves as direct providers. So thank you so much for that. I really appreciate all of you. And anyone else that I might not have named. How can you help DMHS? We appreciate donations, so we have a Give Lively link that you see here, secure.givelively.org/donate/deconstructing/the/mental/health/system/inc. We also have, if you want to pause this, you can scan this QR code here. Please tell mental health and wellness professionals about us. We want to get more people listed in our directory. And if you have a website, add us to your resource or get help page. We would love to be there as well. If you want to know more about our initiatives, the best way to find out what's going on is to go to Linktree, linktr.ee/DMHS. And here's just what it looks like here. So you can see our LinkedIn, our Instagram, our YouTube page for more annual reports, as well as a number of other initiatives and DMHS pages that we want to highlight here. With that said, that is the conclusion of the DMHS 2023 annual report. There is more work to be done. This is just the beginning, and I will see you next year. Take care.